Right. Hello, everybody, and welcome to my presentation on severe acute respiratory syndrome, or SARS, and why it's such an important disease we should be looking out for in our clinic. So kind of to start off, who is the most susceptible to this disease? Basically, those that are in direct prolonged contact with an infected person, those with pre-existing conditions, and those with compromised immune systems are going to be the most susceptible. And kind of going into our clinic specifically, we have a lot of older patients. So those older patients are going to be more at risk. Those that are immunocompromised that we see are going to be more at risk. And then, of course, our staff members that are going to be providing direct care to patients are also going to be at risk. So what is SARS? So SARS is a disease that's caused by a coronavirus called SARS-CoV, or SARS-associated coronavirus. It's in the same family as COVID-19 or SARS-CoV-2, which SARS-associated coronavirus 2. SARS specifically is a viral illness that is characterized by many flu-like symptoms and potentially even respiratory issues, hence the name acute respiratory syndrome. And what are some of the risk factors associated, or what risk factors put people at more risk of contracting the disease? Those with increased age, so especially those about 65 years old, those that are male, those that are in larger population density areas, those in lower income and underserved areas, as they're not receiving adequate medical care, so they're not going to be able to receive treatment. They're not going to be able to. May not even be able to receive tests to know they actually have it. And then also surprising those from non-white ethnic groups, and that's something we've also seen with COVID-19, where we're seeing a lot of Latinx and people of African American descent contracting the disease. So kind of talking about testing, where do we need to do the testing? Well, the biggest thing, we need to make sure that all patients are getting tested and all of our staff are getting tested to make sure we're not spreading this disease. We should be prioritizing those with pre-existing conditions and those that are more at risk or have any of those risk factors I've talked about. And one thing we could do to kind of help this is, if we have the stock, we can provide at-home tests for patients when they leave. And kind of going to, so when is the infectious or contagious period of this disease? Well, the CDC recommends that people stay home and away from people for 10 days while they're infected with disease. Typically, the incubation period is around 2 to 7 days. However, there are some cases where that incubation period was all the way up to that 10-day mark. And why is this so important to our clinic? Well, first of all, this is a highly infectious disease. We've seen very high rates of infection, especially among those with those risk factors. And although it's not very large, there is a significant 9.6 case fatality rate for this disease. So that's also major importance when talking about this disease. Our clinic also has a very large population of older patients, as I mentioned. So they're very much more at risk. And then we also see many patients that have more than one or more of these risk factors I talked about as well. So all of that kind of makes this a very important disease to be aware of, and also to start thinking about ways we can help prevent it from spreading. And kind of going into that, ways we can protect our staff, where we gotta make sure we're wearing the correct PPE, so masks, gloves, eye protection, things like that. And we could also have conversations about figuring out ways that non-essential staff could work at home, those not providing direct patient care, so kind of help to curb that spread of that disease. SARS is spread through the close person-person contact and through respiratory droplets, just like COVID-19 actually. So the virus is packaged up in these little respiratory droplets that people then inhale, and that's how they get infected. And how can we kind of sterilize, clean rooms for patients that have it that we are seeing? Just make sure we're using disinfectant. We're cleaning the entire room with those disinfectant wipes, and then also letting air out for a while, and then even maybe closing the door and bumping up the heat in that room can also help kind of kill off that virus. Some other considerations, I keep mentioning COVID-19. COVID-19 and MERS are both caused by coronaviruses in the same family as the one that causes SARS. So SARS is kind of considered the precursor to MERS and COVID-19. And an important facet of coronaviruses is that they are very highly susceptible to mutations linked to many different strains, and that's something we're seeing with COVID-19 pandemic right now, with the many different strains that have come out, especially in the last few years. So thank you for attending my presentation today. I hope this was informational and this will help you kind of start thinking about ways we can protect our patients. Thank you and have a good